Okay, so cranial nerve 1 is intact. And also your septum was straight, so that's good as well. Okay, so now I'm going to look at your mouth. Okay, so just open up and say ah. Ah. Good. Okay, so the mucous membranes are pink and moist. And to test cranial nerve 9 and 10, when you said ah, your soft palate elevated symmetrically with your uvula and the midline, so that tells me they're intact. I would do the gag reflex to test also, but I won't do that. I won't make you do that. And also, I would say your tonsils were at +1 because I could just barely see them just a little bit. Okay, so now we're going to do respiratory. So if you would, sit in this chair, and we're going to face this way, so sit this way.
Oh, this way.
And if you can, put your legs on that side.
This side?
Yep. Maybe turn just a little bit, just so I have, that's perfect right there. Maybe scoot just.
Like that?
Yeah, here, stand up for a second. Okay, so now just sit right here.
Okay.
Just the way you were.
The way I was.
No,
So-
that's not how I want you to sit.
This way?
No, with your legs that way.
Oh.
Perfect. That's perfect right there. Okay. So I'm just going to look at your anterior posterior transverse diameter, and it looks
Okay.
about 1 to 2, so that's perfect. So I'm just going to lift up your shirt a little bit here, okay? Okay, so go ahead and take a deep breath for me. Okay, so the chest rises symmetrically on both sides. Okay. So now I'm going to listen to your breaths, okay? And I'm going to go on a Z pattern.
Okay.
So just go ahead and take a deep breath when I tell you, okay? Go ahead. Another one. Another one. Another one. Another one. Another one. Another one. And last one. Okay, so lungs sound clear on both sides. And I would also listen anterior and laterally, but we won't do that for this assessment. So now I'm going to test for tactile firmitus, it's called. So I'm just going to make sure that the vibrations are equal on both sides of your lungs, okay?
Okay.
So say 99 for me.
99,
Again.
99, 99.
Good. Okay, so vibrations are equal on both sides, so that is good. Okay, so now I'm going to test for egophony, it's called. And that's just, it's called egophony. It just tells me if your voice sounds are higher, more resonant than they should be in your lungs, okay?
Okay.
So I'm going to listen again in the Z pattern, and when I tell you, just go E, okay?
Okay.
Okay, so E,
E,
another,
E,
another,
E.
okay,
E,
okay,
E,
okay,
E, E, E,
and last one.
E.
Okay, good, there's no egophony, so that is good. Okay. So now I'm going to have you move to the bed, okay, and lay down.
Oh.
Okay, so now I'm going to assess cardiovascular.
Okay.
So the first thing I'm going to do is palpate for heaves and thrills. A heave is increased size of the left ventricle in your heart.
Okay.
So I'm going to palpate on the left sternal border here. Okay, and I don't feel anything. And the thrill is a murmur in your heart, and I'm going to also palpate for that at the base.
Okay.
And I don't feel anything, so great. Okay. So now I'm going to listen to your heart. So I'm going to start with the aortic spot.
All right.
Okay, pulmonic. First point. Tricuspid. And mitral apex. Okay, and S1 is heard loudest at the apex, and S2 is loudest at the base. Okay. And I would also listen with you standing up, sitting in left lateral recumbent position, but I'm not going to do that, so you can just stay. You can stay there.
Okay.
So now I'm going to palpate for your pulses.
Okay.
So I'll start with your temporal. Okay, carotid. Brachial. Okay, radial. And then I'm going to have you take just this one shoe and sock off, okay?
Oh, okay, so I've done my foot before.
And posterior tibialis and dorsal pedis pulse. Okay, I would rate those as +2, and I would also do it on the other side, but
Okay.
I won't do that for this. And I would also palpate the femoral pulse and the inguinal lymph nodes, but I won't do that for this test either. And we'll go ahead and leave that off for now. Okay? So now I'm going to assess your abdomen, okay?
Okay.
Okay, so I'm just going to look first. I don't see any distension. The skin looks nice and moist. I don't see lesions or scars or anything. Now I'm going to listen in all 4 quadrants. Okay, you have active vowel sounds, so that's good. Okay, I'm just going to palpate just lightly, okay? Do you have any pain or tenderness when I do that?
No.
Okay. Now I'm just going to do some percussion. Okay.
That's good.
Timpani is normal over air-filled organs. Good.
That's good.
Okay, so now I'm going to palpate your liver. So just relax. I'm just going to put my hand under here. Find your rib cage. Take a deep breath for me. Okay, and exhale slowly. Good, so I just slightly feel the lower border of the liver, so that's good. And if you could switch sides and lay this way.
This way?
Yep, so switch your head down to that side.
Oh.
And
Oh, my
We
head.
can put a pillow down here for you. Yeah, you can go ahead and take that off. Perfect. And just lay flat on your back.
Oh, my back.
Yep. Okay. So now I'm going to palpate your spleen, okay?
Okay.
Okay, so go ahead and take another deep breath. And exhale slowly. Good, I don't feel the spleen, so that is good.
That's very
Okay.
good.
You can go ahead and stand up or sit up.
Okay.
Okay. And actually I'm going to have you stand up and
Okay.
face this way. So turn around.
This way?
Yep. So now I'm just going to assess for your CVA tenderness to make sure your kidneys are okay, okay?
Alrighty.
So just tell me if you feel tenderness.
No,
No?
no, feels good.
Okay. And while I have you standing up, I'm gonna go ahead and do the Romberg test to
Okay.
test for cranial nerve 8. Okay, so go ahead and close your eyes and just stand there. Okay, and I don't see any abnormal swaying, so your balance looks good. Okay, and also while I have you up, we'll go ahead and test your gait. So go ahead and walk towards Jack there. Okay, and then come back on your heels. Walk on your heels like this. Perfect, and now tippy toes. Good, okay. Go ahead and sit back down. And your posture looks good as well. Okay, so now we're going to do range of motion of your arms. So go ahead and lift. You can sit. Just lift one arm out and move it up, down, and go around like this. Perfect, that looks great. Okay, and now lay down one more time. We'll test the range of motion of your lower legs. So go ahead and move your leg in like this and out to the side. And can you move your hip down, out to the side?
Oh,
Yep, that's good. And back up, and can you lift your leg up like this? Good, perfect. Okay. Alright, so now I'm just going to test some sensation things so you can sit back up.
okay. Up and down.